Dubai Eye 103.8.
103.8.
I don't know if you've noticed, obviously you have, it's a little bit warm out there. We are in the midst of the UAE summer, which is nothing new, comes around about this time every single year. So we know what to expect. Obviously, higher temperatures, more often than not, higher humidity. Conditions get a little more difficult for a lot of people, a lot of animals here in the region, but especially those with pre-existing skin conditions. And of course, those that have skins that react to these summer conditions. To that end, we have been monitoring a few comments coming through from listeners over the course of the last few weeks. And we thought it was only fair to welcome into the studio a specialist to address these questions, but also to give us her expert opinions on what can be done to prevent or, of course, contain any skin flare-ups at this time of year. So talking summer skin problems, it's an absolute pleasure to welcome into the studio dermatological specialist at the Canadian Specialist Hospital. It is dermatologist Dr. HINAH ALTAF, who joins us live here in studio. HINAH, thanks for being with us.
Hi, thanks for having me here.
Really kind of you to take time to come and address a few issues that maybe people, are feeling a little uncomfortable to address at the moment. But is there a common link between what we're talking about there, the weather conditions at this time of year, and skin conditions?
Oh, of course, there's a huge connection between climate and skin as such. And summer tends to worsen many conditions. And it's not only summer, it's the extremes of temperature that we are navigating. I mean, you're in AC and then you suddenly move to 40, 45. That also creates a lot of problem with skins of many people. I mean, the extremes that we have to see.
What would you say are the most common issues that people suffer with at this time of year?
There are problems that are caused by summer, and then there are problems which are worsened by summer. That means people who already have an existing skin condition, that'll get worsened. For somebody who has normal skin, they could get sweat irritations with sweat rashes. They could get a lot of maceration on the skin that leads to fungal infections, especially on the feet. People tend to swim a lot, so you can get swimming-associated problems, swimmer's itch, swimmer's ear. And then there are people with skin problems whose skin can worsen, as in people with eczemas, people with acne, a lot of humidity, and the pores get clogged. And even in serious conditions like you have SLE or conditions like that, those can worsen with sunlight, temperature, humidity.
It's interesting you mentioned eczema there. Just had a text message coming in from Tony this morning saying, Aussie eczema sufferer going into the summer here. Terrible time of year for me and others. Currently have it on my wrist, on my shoulders, in front of and behind my armpits, inside of my elbows, back of my knees, my groin area, and a patch on each calf on the inside of my leg. So thoughts with you there, Tony. Thank you very much indeed for sending us that text message. But is that something that is indicative of an eczema sufferer at this time of year? Can they see the eczema expand to other parts of the body?
Of course, you can see flares in eczema with extremes of temperature. I mean, it'll get more itchy, it'll involve more areas, and it can even weep. I mean, it'll be an oozing dermatitis. For people even with good control, with extreme heat, it can worsen. It can start a flare.
So in terms of what to do about the flare-ups, I mean, if somebody has pre-existing eczema and they are controlling it, etc., is it just a case of more of the same, or do you have to address those flare-ups?
It is essentially more of the same, but you also have to address it in newer ways. As in, when we see that the temperature is high and the climate is humid, we expect that the moisture in the skin also increases.
Yeah.
But it doesn't happen like that. In summers, your skin can dry up more, which doesn't sound very logical, but that's how it happens. It dries up more, so you need to moisturize more. And for eczema people, you have to use non-irritating cleansers, which you always use. And we tend to wash more in summers. So if we are doing that, we need to moisturize more. Yeah. And also people tend to go a lot for swimming. For eczema, as a doctor, to be honest, it's really painful to stop somebody from swimming, especially small kids when they come and when their parents ask if they can swim. I really don't have the heart. People can swim with eczema. They just need to add a few precautions. I mean, you need to moisturize your child 1 hour before going to the swimming pool. And, it sounds strange, but for some kids, swimming pools improve their eczema because it has chlorine. And sometimes we give bleach baths for eczema. And that works. The chlorine bath works for some children. So it's not an absolute no. For some children, it might work. For some, it might not. Even in those children, we need not stop them from swimming. Just apply moisturizer 1 hour prior. And once they come out of the pool, take a shower, not with hot water, and immediately moisturize within 1 or 2 minutes.
So would you put, obviously being outside, would you put sunscreen on after the moisturizer?
Yes. First, the first layer has to be the moisturizer in an eczema skin.
And spending time, obviously, in pools and in the sunshine, and the use of sunscreens, would they have an effect to exacerbate any skin conditions as well?
Of course. That's why it's very important to choose your sunscreen wisely. Sunscreens also can cause phototoxicity. I mean, you're fine inside, but once you move out in the sun, the sunscreen makes you more prone to the photoallergy. In eczema kits, basically in all kits, we should use physical blockers only. That means those containing zinc oxide and titanium dioxide. They are fairly safe.
Or would it be better just to wear like a rash vest, a UV rash vest instead of
That would be ideal. Covered clothing would be ideal. But sometimes you still have exposed areas. You still have your hands, your feet, your face. On that, you will need sunscreen.
Talking skin conditions this morning here on the agenda. Can skin conditions be exacerbated during the summer months? Are you a sufferer from a dermatological or a skin problem? Is there something that always flares up at this time of the year because of the humidity, because of your activity in warm conditions? If so, we'd love to get your thoughts into the show. Text us now on 4001. Why? Because we've got one of the leading experts of all things dermatological here in the studio at the moment. Dr. HINAH ALTAF is a dermatological specialist at the Canadian Specialist Hospital, is here with us in studio talking summer skin problems. Again, Dr. HINAH, thank you very much indeed for being with us. Let's just address that, because one thing or recurring theme we seem to hear or see is people having conditions but not coming forward to talk about them. I've had a couple of text messages already today of people saying they've got eczema, but they've not sought advice from their doctor. Is that one of the things that you see? Do people not talk about do they get embarrassed by their conditions?
They don't get, I wouldn't say they get embarrassed, but they get lazy. And by the time they reach us, it has already spread far and wide. I mean, it is already advanced. And then we need more medicine to control it. You should always seek help when it is at its initial stage. That makes it easier for the doctor, easier in the sense that we need to use less medicine to control the condition.
This one just come through from Sculio this morning saying, so I have eczema, but I've never gone to see a doctor, so I haven't been able to get answers for any questions. Didn't get any sort of dry skin or eczema problems till I was 17. Is there any reason why that would be? Also, is there a reason I would only ever get symptoms during the cooler months as well, not so much during the summer months? So is it something that can come later on in life?
Yes, we do know. There are, basically any kind of dermatitis on the skin is labeled by a non-doctor as eczema. Firstly, we need to know it might necessarily not be eczema. And now, if it is eczema, yes, we know one type of eczema, that is childhood, which will come around 6-7 months of age. It can also come in adulthood, even though it is less common, but we do see adult onset atopy. We do see adult onset eczema. And the fact that it is getting worse in winters is absolutely true. It is in winters mostly that we see the skin gets drier. The moisture in the air is less. Even though in Dubai, it's the opposite, because in summers you're exposed to colder temperatures inside. So here it's kind of, it doesn't work like that. Otherwise, what our books say is eczema gets worse in winters and it improves in summers. But in Dubai, being exposed to the AC temperatures inside, your skin does get dry and it gets worse in places where you're more exposed to artificial temperatures.
Interesting.
I mean, Doctor, we were talking earlier about, you were saying moisturization of the skin is key with a lot of these things. And we talk about, getting dehydrated skin a lot during the summer because of the ACs and the outside temperatures. What about water intake? If we have skin problems, should we be increasing our water intake to help kind of hydrate from the inside?
There's a lot of hype about this water intake. I'm not anti-water. But, our body does have a mechanism which guides us towards how much water we need to drink. And sometimes it's not only about water in the skin, it's also about oil. Drinking water will not substitute for the oil that you need in the skin.
So what replacements can we do? I guess we're talking about, is it sebum, isn't it? The oil in the skin.
Yes.
So what can we do to make sure our skin is lubricated, if you like?
See, basically, we also have hydration, okay, to some extent, but it will not replace your need for a moisturizer. The choice of moisturizer is very important. The moisturizer has to be basic. You don't have to go for any fancy, colored, fragranced products. No. It should be white. And if you can tolerate petroleum jelly, that is the ideal solution. I mean, that is very basic. That hardly causes allergy in any patient. The scented ones, the fancy ones with fancy packaging, that doesn't really do its work, and that might worsen it. That might create problems for the skin.
I had another one that's come through, no name with this one, saying, my skin problems seem to always flare up, itch or otherwise, during or after a flight. Is there any reason for this and any advice that you can give?
Absolutely. Flight is also, again, a pressurized cabin. It's again, the atmosphere is very dehydrated. So again, it's related to your dry skin issues. And plus, you do not maintain enough hydration also in a flight. And sweating also. There's a lot of factors that contribute to your itchy
storm.
skin. Absolutely. And if it's a longer flight, then
So it's best to hydrate whilst in flight or before the flight or during the flight?
See, before the flight, you have to apply moisture. Yeah. Anyways, you have to moisturizing is basic. I can't just overemphasize it. It might seem that I'm saying again and again, but this is really a lifesaver, a skin saver. And you have to moisturize. You can, even if it's a long flight, in flight also you can moisturize.
Yeah.
There is no...
When it comes to, I just had a question about moisturizers. Being where we are and obviously exposure to the sun a lot, could you use sunscreens as a moisturizer?
Absolutely. That is such a good point that you raised. That minimizes the number of products that you're using, and that increases the compliance. Rather than telling a patient, first use this, then use that, then use this. It's difficult to follow also. I realize as a doctor, the patient will not be able to follow through. So what we do is we ask the patient to select a sunscreen as per the skin type, the base of the sunscreen. If it's an oily skin, what kind? If it's a dry skin, so that both your needs are met with the same product. The lesser you keep, the better it will be.
I love that, because obviously I think you probably want to minimize the things you put on your skin, because I guess lots of products could actually cause flare-ups.
Flare-ups, and it is cumbersome to use so many, one after the other, and then it's no point if you have a substitute.
Interesting, though. We just had a comment from one of our listeners out there. And again, maybe I'd like to get your thoughts, Doc, on this. The comment says, look, we wash our clothes with disinfectant, but that really doesn't help. One should hand wash your clothes and towels in the sunlight in order to get rid of fungal skin infections. Seems like maybe that's the right way to do things, but it's not exactly practical at the same time.
No, this is a very important point that you raised, and I would really like to throw some light on it. This disinfectants, these medicated soaps, please stop all of this. We do not need it. And these are very harsh. these will make your skin, these will irritate your skin, and it can worsen skin conditions. Whenever I have a patient in the clinic, the first question that I ask is, are you using Dettol? Are you using Lifebuoy? Are you using any of the medicated soaps? Please stop. Just if you want a bar, use a basic white, non-fragrant bar. No medicated soaps and no disinfectants. We don't need them. You know what? For fungal infections, if you're using a disinfectant, a bacterial disinfectant, it'll kill the bacteria. It'll worsen your fungal infection. So if you really don't know the details, it's better to go safe and use something which doesn't have anything to do with medicine. Use a basic, bland soap. Also, now that we're talking about detergents, I would raise this point of softeners, fabric softeners. We should generally try to avoid fabric softeners, especially for people with sensitive skin with eczema. They cause a lot of problems in the skin.
Farah's also been in touch. Farah says, I wonder if the doctor could advise. I have boils and bumps that seem to develop on my feet. I know that the parts of my feet that have friction with the footwear, regardless of the material, I get a reaction in that area with a very irritating and scratchy and sometimes causes fluid-filled boils. Any idea what this could be? I don't have any other skin issues of note.
What she's describing looks like a type of eczema. This, what happens in this is that this is more common in summers. This comes as small vesicles, small blisters, which appear under the skin. Usually the most common site is the feet. Usually comes on the sides of the toes, sides of the feet, even in fingers. And it's intensely itchy. And then it resolves within 2-3 weeks with with peeling of the skin. And this is a type of eczema. We call it dishydrosis.
Okay. I've got a quick question as well, because we mentioned earlier on today about this whole, the fact that we see a spike, an increase in the number of conditions at the moment. Parents with young children, especially when you mention a lot of young children will be outside, it might be in the pools, etc. One of parents' worst fears when it comes to their children is a rash. If a parent sees a rash on a child, they immediately start getting worried as well. And yet this time of the year, we know that heat rash and prickly heat and other things can be can be more prevalent. Is there any way, rather than rushing to A&E saying, my child's got a rash, deal with it, for a parent to tell how severe a rash is?
First, it depends on for pediatric conditions, generally the well-being of the child is very important. If your child is smiling and he has a small little rash, it's all right. He's all right. He's feeding well. He's happy, but he's itching, which is okay. The child looks in distress, even if the rash is small. That needs medical care immediately. Then the area. Even if we know sunburn is minor, but if the area of involvement is too big, then that needs immediate medical care, especially for children. Then depends on any associated features that you have with the rash. Like if it's a rash with fever, or you notice some other associated symptoms like an upper respiratory or something, that needs medical advice immediately. For insect bites, small bites, the kid is well, you don't need. But if you feel it's a bite and the child doesn't look well, anything abnormal, however mild, in the behavior of the child warrants immediate medical help.
Talking summer skin conditions with our very special guest here in studio this morning, Dr. HINAH ALTAF, from the Canadian Specialist Hospital, giving us her expertise and advice. A lot of people getting involved with the conversation because it is this time of year that people see a flare-up in a number of their conditions. This one's come through from Candiro saying, I've always had mild eczema and I try to manage it with moisturiser. The biggest problem I find is not itching as well. I can't help myself but itch my eczema, and that seems to make it even worse. I mean, that would go without saying, wouldn't it, that if you itch a problematic area, it is going to make that condition worse. But, I mean, is there any way to stop the itching or not? Is that just one of the problems?
See, this avoiding itching an area is also a bit overrated. It's okay if you itch a little. It's not.
Scratch that itch a little.
Just trim your nails and itch with the ball of your fingers. It's okay. It's not that bad. Regarding how to stop itching, wet compresses work very well for itchy skin. You have to put a cloth, any nice, dip it in water, and you can wrap it around the itchy area if you want to avoid medicine. That's a nice. Wet compresses work very well for itching. Then you have the over-the-counter soothing lotions like calamine. These things also work very well for soothing. But the best thing that works for itching is, of course, a sedating antihistamine, which you have to take in the night. That's the gold standard.
Yeah.
That's the thing that works.
That's the gold standard, the go-to as well. Got another one that's just come through here. Thank you very much indeed to this. This is from Warren saying, I have had eczema for as long as I can remember, from about 19 years old. Last summer was the worst in memory for me. I was constantly flaring up along my face, my neck, my chest, my arms. I've been able to manage it, but that's all I'm doing at the moment is managing. I've heard somebody mention to me in recent times UVB phototherapy. I just wanted to get the doctor's thoughts on whether this is something that I should consider.
UVB phototherapy is a very good therapy for skin diseases. The fact that it is very safe, we are not exposing you to any medicine.
Okay.
It makes it ideal, especially for children or even adults. And UVB is used to treat many skin conditions. The only thing that we need to watch out is that the skin condition is not worsened by sunlight. As in, there are certain conditions, like for people with eczema on the face, and they say that once they go out in the sun, it gets worse. UVB would not be for them. There are skin conditions which are improved with sun, and there are in some patients it gets worsened. So in them, it's not for them. But if it's in covered areas predominantly, and the patient has not noticed any worsening with sunlight, UVB would be really nice.
I just wanted to bring up this text message, which sounds quite alarming, actually, saying, I have severe dry skin on both my legs with dead skin, which is still attached, and it's black. It's now spread to my back and up my spine. What is this, and what can I do about it?
This sounds like, even though I've not seen, sounds like ichthyosis. This is a genetic condition. It could be seen since childhood, and it then progressively increases. And you can only exfoliate. For genetic conditions, we can't really completely cure you, but we need to exfoliate. And you need to use exfoliants, and you need to use urea-containing moisturizer. Those things work very well for ichthyotic skin conditions.
Irshad, hope that one helps you. I hope all of the comments that have come through have been helpful. Got one final one here from Jacob, who's been in touch, saying, can we apply olive oil on dry skin? Is that something that is advisable?
Olive oil is also a moisturizer.
Yeah.
It is good, but it depends on where you're getting from. If it is pure, I have no issues. But if you have added some preservatives, then it is going to harm.
Yeah.
Pure virgin olive oil, if you can procure and you know the source, it is definitely going to help.
Yeah, I think I went on a holiday to Greece once when I was talking to the locals in the island in Greece, and they said that was the best suntan lotion. That was the Greek suntan lotion. I was like, right, hang on, whoa, this is taking it a little bit too far.
But you see a lot of products now, a lot of the natural products have olive oil is a latest thing, and I've seen argan oil turning up in a lot of moisturizing products recently as well.
I'm sorry, but I'm anti-oil in that respect. all the sunscreens have sunflower oil and all oil. No. Please keep it very basic. Minimum number of components.
Would that be your rule of thumb? If people wanted a bit of advice to take into the summer to help control their sun conditions or skin conditions at the moment, what would that piece of advice be from you?
I mean, just use basic things. If you're using a sunscreen, just a sunscreen. Don't add fancy things to it with the oils, the retinols. No, it's not going to help.
Yeah.
For moisturizers, also basic. Just don't go for many fancy. The cost is also increased, and it's not giving you any benefit. In fact, it might worsen the skin condition.
Dr. ALTAF, it's been an absolute pleasure. Thank you so much indeed for coming on in. You're down at the Canadian Specialist Hospital. Obviously, people can find out details online. They can get in contact with you and your colleagues via the website. Is that the best way?
Yes, that is a nice way.
Do it via the website. Do it via the social media channels. We'll post up all the details on our site. But for now, Dr. HINAH ALTAF, thank you very much indeed.
Thank you. Thanks a lot.
This is Dubai Eye 103.8.